Hi, everybody. Nico here from Redox. We're going to get started here in a few moments. We'll just let everyone get settled in. If you're looking at the screen right now, take a look and write something on the right chat room. If you want to just write a quick one-liner on what you're actually working on, it'd be great to kind of hear from everyone and hear the different projects people have. And we'll let people kind of fill up that chat bar with the different projects they're working on while we let everyone pile in, and then we'll get started. Okay, that's probably enough back and forth on the video for now. This is Nico here from Redox. Thanks everyone for joining in. I see a lot of cool ideas popping up on the chat room. So if you guys want to keep that going over the intro section here, that'd be awesome. Just kind of write what you're working on. I see Force Therapeutics in the house. We got a telepsych company. A lot of great healthcare apps out there, and that's kind of the point of this webinar today, is to kind of talk through some of the innovations that are going on and some of the things to think about along the way. So I'm going to pass it off to Chaz from Aptible, who will kind of walk us through the first part of this and bring us through HIPAA and some ideas around that space. And then we'll pop in and talk through some of the integration considerations. So Chaz, let me hand it off to you.
Okay, great. So let me get some slides up. And what do you think? Do we see slides now? There we go. Okay, so my name's Chaz. Some of you, I know a lot of you guys I've probably spoken to. We're all kind of in the same industry. Some of our customers, some Redox customers here, which is great. So today we're going to be talking about go-to-market strategy for digital health companies. Go-to-market meaning what do you make, who are your customers, how are they going to find out about it, and how are you going to get whatever you're making into their hands. And specifically, we're going to talk about two tricky areas. We're going to talk about HIPAA and sort of privacy and security regulations, and we're talking about EHR integration. And so we're going to split the talk into two sections. I'm going to take the first section, talking about HIPAA and go-to-market, and then Nico and Redox will take the second section. So let's see. Okay. So the audience, everyone here is either a digital health company or working on a digital health product. Almost all of you have, at least, if you're not a SaaS company, you probably have a SaaS component. And you know that for new technology, getting to market very quickly is usually really important. If you don't get to market quickly, somebody who's bigger, better funded, and has more people and resources can eventually get there and take your market. So you want to get there first. In healthcare, that's true for every technology market. In healthcare, it's incredibly important, not just to get there fast and first, but to get there safely too, and make sure you don't end up with a breach or some kind of security issue. The reason why you should listen to me, I'm a co-founder of a company called Aptible. If you haven't heard of it yet, you probably will be checking it out soon or now. My background is I'm a lawyer and a software engineer, and we've been running Aptible for about 2.5 years. So we see a lot of software companies working in healthcare and working in HIPAA compliance. And Nico will tell you a little bit about his background when he goes into his section. For the entire webinar, what we're going to cover here, this is sort of the breakdown of what we're going to do. We're going to talk about just a quick overview of the state of digital health. We'll talk about what go-to-market strategies are and what they mean. And then I'll talk about a little bit about what HIPAA means and some strategies there. We'll turn that over to Redox to talk about EHRs and next steps, and then we'll answer questions, and hopefully we'll have a bunch of questions. As we go along, there's the right sidebar for the chat, and there's also the question or topic suggestion in the Crowdcast pane. So like Dan has already jumped in and asked a question. If you want to just queue your questions down there, we'll cover them at the end, and hopefully that'll probably be the best part. Okay, so digital health. Digital health is a great area to be working in. If you're in technology and you're interested in healthcare, the time is right. The last couple of years have been amazing. We've seen expansion of digital health and healthcare funding. It's coming up on double digits in terms of total venture capital funding. It's a very active market, and it has been. 2014 and 2015 had similar totals, but the headline is not that funding was flat. The headline is that digital health funding has skyrocketed and coming up nowhere in the past 2 or 3 years. We got hundreds of companies raising significant amounts of money to test and validate ideas and bring them to market. We're starting to see deal sizes creeping up. We're starting to see more mature, later stage companies, either later stage in funding rounds. We're starting to see more, Series C plus, multiple venture funding rounds. We're starting to see significant M&A activity, so companies are getting acquired, and we're starting to see more digital health IPOs, not just healthcare or pharma IPOs, but actually like digital health IPOs. So it's a good time to be working in healthcare and in software especially, and we expect that to continue over the next couple of years. We think this is just getting started. The funding and sort of interest is spread around. If you look at, healthcare consumer engagement versus care coordination or wearables and biosensing, these are all like significantly different products, different market segments, different tools. So when we say digital health, there's a lot going on in digital health. There's a wide variety of companies, products, strategies, and customers. So digital health is there's a lot going on. No two companies, there are some companies that are doing similar things, but in general, there's a lot of variety, which means that anytime anybody like me proposes to tell you about digital health, what that really means is that we're going to be making blanket statements here. So when we talk about go-to-market strategy is really simple. It's just how are you going to make money? How are you going to get into the market? So what are you going to make? Who's going to buy it, and how are they going to find out about it? And then critically, most importantly, the part where you actually go to market is how are you going to get it to them? How are you going to deliver it to them? And so what I'm going to talk about when we talk about HIPAA is barriers to the last part. Barriers to, you can make the greatest app, you can identify your customers, you can market the hell out of it, but when you're actually going to deliver it to them, you may run into some issues. The most important question probably for thinking about go-to-market is who are your customers? And by customers, I mean, who's going to pay you? So that might be different than users. Your users might be individuals, they might be patients, they might be doctors. Your customer is who pays you, and the organization or the entity that is going to keep you in business. And the reason that's important for go-to-market, and especially for regulated industries, is that for example, with HIPAA, you're regulated if you handle regulated data, and you have to handle it on behalf of another regulated entity. if you're a business associate, it's a type of regulated entity under HIPAA. And so when you look at the question of are you handling data on behalf of a customer here, the most intuitive way, the most sort of like significant way is to get paid by them. So if you're handling Blue Cross data and you're getting paid by Blue Cross, it's pretty clear that you're going to be handling that data on behalf of Blue Cross. So again, we see wide varieties. We see hospitals, provider networks. We see entire healthcare systems. You see smaller primary care providers. You might have a 1-doc shop. You might have a primary care network. You might have a 300-doc shop, something like that. What these all have in common is that they're all going to be directly regulated, and you're going to have to pay attention to privacy and security concerns of that data if you want to sell to these companies. Now, on the right-hand side, so you see these two columns here. There's hospitals, businesses, big businesses on the left, and on the right-hand side, you have patients, general patients, patients of, if you have a particular type of disease, families, coaches. On the right-hand side, those are all entities where if those are your customers, if those are the entities that are paying you, you might be in a different category. You might not necessarily be regulated at first, but these are all sort of in the realm of potential customers. There's a bunch of different ways that you can get regulated. You can get HIPAA's probably the one that everybody is here for and is the most common sort of source of regulation within healthcare. It's the most wide-ranging, and it also is sort of the most serious because it has actual active enforcement like going on right now. You can get regulated by the FDA if you make software that can be classified as a medical device. That's a whole headache, but it can be very valuable. Because the FDA can block you from being in the market. They can literally send you a letter and shut you down and remove your product from the market if they think that you have not complied with their regulations. The FTC, the Federal Trade Commission, regulates two types of data, privacy data. They regulate kids' data, children's data, the Children's Online Privacy Protection Act or something like that, COPPA, and consumer privacy in general. We don't see a whole lot of activity from the FTC, but the FTC has been talking over the past 6 months about more stringently enforcing some of their privacy jurisdiction, including in healthcare. And there may be it won't rise to the level of a public battle, but there may be an internal battle in the next president's administration about how health data and healthcare data is going to be regulated, because HHS is the regulatory proponent of HIPAA, and then the FTC is making noise about getting more interested. And so that'll play out probably over the next 2 years. And finally, we have state privacy laws. So these are state-by-state laws. Usually they're not healthcare specific. Usually they have to do with personally identifiable information, but they may call out certain types of data, social security numbers, health insurance, record identifiers, stuff like that, for special treatment. And so, for example, in Texas has a state law that it's actually more stringent than HIPAA in some ways, and that imposes special requirements on healthcare companies. California, Connecticut, and several other states have breach reporting laws. So if you were to suffer a breach under HIPAA, you'd probably have state privacy reporting obligations as well. So these are all, talk to a lawyer, find a lawyer and talk to them. These are all areas where you should just be aware of them. We're going to talk a little bit about HIPAA, but not too much. I'll give you guys two resources here for HIPAA 101 type stuff. There's way more information about HIPAA, and even the basic HIPAA 101 stuff is a little too complicated to go into in half an hour or 30 minutes. So we have two blog posts here. One is up on our blog. If you just Google Aptible HIPAA questions, it'll probably take you to our blog site. And there's it's almost, I think it's over 2,000 words of HIPAA questions, and it's specifically for software companies. This is the kind of 101 type rundown that we give you as a part of your security officer training, or if you're going to stand up a program. This is the introductory material for a course like that. There's another post that Rock Health has up on their site, the HIPAA for Dummies post, and there's still some good information in there. So if you wanna learn more about the basics of HIPAA in a little more detail than I'm going to cover here, I recommend getting to these two posts, and we'll put these slides up later for you. What I'm going to say about HIPAA is generally, I'm going to leave most of my my time here for the questions. What I'll say about HIPAA is that if you are regulated under HIPAA, HIPAA has a lot of, literally hundreds of different requirements, but they all break down into generally 3 categories of requirements. So you need to do 3 things. The first is you need to implement controls, and these controls may be administrative, like internal controls, policies and procedures that you have, ways of doing business that you train your workforce on and enforce. But they control, or they may be technical controls like encryption or access controls, only granting access to certain applications or databases to your users, whether they're your internal users or whether they're your customers or whether they're your business partners. But you have to control how you use regulated data and how you send it to third parties. And that may be like a third party who's getting a data dump from you, or it may be just like a vendor that you're using. Google Analytics, right? Mixpanel, any kind of third-party API. If you're thinking about using Intercom on your site, or what about if you're going to use Zendesk for customer support, or what about if you want to use Twilio for telephony? These are all third parties, and they're all sort of data disclosure issues. So privacy and security issues that arise around how you design and build your infrastructure. That's way beyond the scope of what we can cover today, but those are all examples of things that you need to not just worry about, but you need to make decisions about, document those decisions, and be able to enforce them over time. That relates to number 2. So the second thing you need to do is you need to be able to manage security and risk according to formal rules that you specify ahead of time, and then you need to be able to create evidence, proof, that you followed your own rules. And that is really important, because if you're ever going to go through a security review with a large customer, or if you were happen to be audited either by HHS or enforced against by HHS, or if you just want to go through a third-party certification like a high trust or an ISO 27001 or SOC 2, those are the things that those auditors are going to be looking for. And finally, you need to be able to become aware that if you have a problem, like a security incident or a potential breach, you need to have processes and technology in place that would make you aware of it, and then you need to have sort of a game plan for what happens for security incidents and breaches. So what we see a wide variety of business models and a wide variety of potential customers within digital health. What they all have in common is everybody is going to fit into one of these 4 go-to-market approaches with regards to HIPAA. So the best approach, HIPAA is a pain in the ass, so the best approach is to avoid HIPAA entirely. But there are some customers, like if you're selling to a hospital, you probably are not going to be able to do that. So if you're making a health coaching app or something for patients, the good news for you, like Fitbit, for example, for a long time, Fitbit, Jawbone, and these wearables companies avoided HIPAA entirely, which was great. You might have heard recently in the news that Fitbit has a HIPAA compliant offering at this point. And so what they've done is they actually opted for number 2, which was they avoided HIPAA for a long time. And now they're getting into more clinical information. And so that they had to plan to handle PHI later. So you can avoid being regulated, but you can sort of start thinking about the basics of HIPAA to enable yourself to move into a regulated market later down the line. The third type that we see is companies that are not technically regulated, but they want to, but the nuances of why they're not regulated would be lost on their customers, and they want to represent themselves as HIPAA level, or they want to put some kind of formal risk and security management program in place, and then they want to market it. They want to go out and they want to brag about how seriously they take security and sort of the measures and things that they put in place. And so even though they may not technically be regulated, they borrow HIPAA as, a healthcare privacy and security framework, and they act like a regulated entity for their own risk reduction and marketing purposes. And then the fourth one is the most common one, which is you just suck it up and you become compliant. You do all the administrative and technical and sort of legal hoops and processes. You put those in place, and those are what you can go look in the blog posts I referred to before. The reason why number 4 is probably the most common is that even though HIPAA only regulates data that's touched at some point in an insurance transaction, almost all of the really good data is the most meaningful. Anything that's related to usually payments, anything that's related to clinical care, a lot of times that's going to be regulated by HIPAA. So all the really good, juicy, meaningful data is usually going to be regulated, which means if you touch it, you're probably going to be regulated too. So we see that, and that's where all the money is for the most part in healthcare right now. Okay, I'm going to turn it over to Nico and the Redox guys, and we're going to talk about EHRs.
Thanks, Chaz. Nico here from Redox. I am not Redox George. I am just using his account. He's sitting right here, just so you know that I'm not totally stealing his identity. Really excited to talk to you guys about integration. We wanted to partner with Aptible today because if you're going to do integration with the EHR and with health systems, you're going to need to be HIPAA compliant because the data that we're exchanging is protected health information. So it's kind of a prerequisite to doing or thinking about any integration work. So let me get my slides up here so we can talk through some of this stuff. I can figure it out. Hey guys, having a hard time getting the slides up. Here we go. Okay, cool. Okay. Switch to your. Cool. So a little background on Redox and where we come from. Pretty much our entire team used to work at Epic. So we were responsible for building, implementing, and integrating with Epic and other large EHR systems out there. So that's kind of where our background comes from in this space. A little background on the EHR landscape. As a definition, the ONC says that an EHR is a digital version of a paper chart. And I think that's a really outdated definition of what the EHR is, but it kind of gives you some context as to what some background on the EHR space. It was really designed and developed to do just that, to take the paper charts that docs had in their clipboards and make a digital version of them. And so that's why currently, they lack a lot of that functionality that we think they would have as far as, doing advanced analytics, as far as streamlining workflows and engaging patients in a realistic way. Some of the information that's available within the EHR is listed here below, and it spans the gamut from clinical information on the left-hand side, all very patient-centric. So looking at this information, you're going to be talking about a specific patient, and you can see this stuff for a specific patient. And then, non-clinical information, around the patient demographics and their appointments and the visits they've had, insurance and payments. But one of the key aspects of the EHR is that it is patient-centric in the sense that most of this data is stored for a specific patient rather than, a cross-sectional view in the sense that, maybe you want to see everyone who has a specific diagnosis. That data is much more difficult to pull out of the EHR. Because of the patient-centric notion of it. Additionally, you might hear people use EMR, electronic medical record, versus EHR, health record. And that's something that it was kind of a point in time where suddenly the industry switched to EHR. So that's what I propose here is we all start saying EHR from now on. ONC started using that in their meaningful use documentation. So that's when the industry kind of followed suit. Speaking of meaningful use, in 2010, we saw the government put subsidies around the adoption of EHR technology. So throughout history, EHRs came about in the early 70s or so is when the first ones started coming out. And then as with the adoption of computers and subsequent technology, we started seeing more and more doctors' offices use EHRs. Current day, we have 85 to 90% of doctors' offices have some sort of EHR in use. You see the sort of spike in adoption in 2011, 2012, the slope increase there as meaningful use became more stringent and started subsidizing and penalizing people for using or not using the EHR. Within the ambulatory space, within the outpatient facilities, this is how the breakdown looks between different EHR vendors. So you see Epic has about 20% of the market in 2014. This is based on people who actually took money from the government to adopt medical records. They had to submit which vendor they were using. And so as you can see in the ambulatory market, we have a very fragmented market space. There are literally dozens and dozens of EHRs out there that that support this type of technology for these doctors' offices, and the biggest market share is shared by a whole bunch of very, very small players. So the integration strategy here really has to encompass the different types of EHR systems that are being used at various outpatient clinics. On the hospital side, 2014, 2015, we saw around 97% of hospitals are using some sort of certified EHR technology, meaning that it's very rare to find a hospital out there still on paper. The market's pretty much saturated in that bucket. And again, here we see Epic having around 20% of the market, but sharing really half the market with Meditech and CPSI. So the hospital space is much less fragmented. The very large hospital systems will likely be on Epic or Meditech or Cerner. And then, some of the smaller ones will share the other EHRs out there. So the reason why this is important is that understanding, what EHR vendor it is gives you a little bit of sense of how you'll actually access information within those EHRs. So the vast majority of EHR implementations are on-premise. And what I mean by that is that they're implemented in a health systems data center, actually on-premise at that health system, down in a basement somewhere, along with other systems that the health system might be using. They might have a separate lab system or scheduling system or their clinical research systems. And these systems are all tied together with an interface engine that can translate data between these. And one of the common misconceptions that we hear is that your application is built in a cloud environment, most likely. You're hosted using someone like Aptible on AWS, some sort of cloud environment. And in order to actually integrate with the EHR at the health system, you have to maintain a connection to each of the different data centers, each health system you're working with. So in this diagram, we're talking about 4 different health systems. So you might have 4 different customers, and that means you're maintaining 4 connections to each of those health systems, to the EHR that's installed on-premise at that health system. So you're not integrating with the EHR vendor. You don't have a connection maintained to Epic. You have a connection maintained to each of the data centers. So when people say Epic integration or Cerner integration, it really means integrating with the health system's data center that hosts that EHR technology. So this is kind of, high level of what your integration sort of web will start looking like as you get more and more customers. We're talking more and more connections into these data centers, normally through a VPN style connection. Within those data centers, they're using what's called HL7, Health Level 7. It's a sort of quasi-standard that's supported by every major health IT system. And it's used to send messages between these systems within a data center. So it was designed to be used within one data center, not really designed to be used between data centers. And this is what brings up some of the challenges in integration. The HL7 that's used at one health system is different than what's used at a different health system. It's configured within the walls of that data center, and also varies between the different vendors that health system might be using. So the interface engine is a key part of the integration within any health system because it's bouncing around those HL7 messages. I kind of think of it like a box of mirrors with some translation in there. So the data that's produced by EHR will be sent into the interface engine transactionally, and then the interface engine will sometimes remap that to a different format of HL7 or simply bounce it off like to the lab system or to other systems within the data center. The other thing to note about HL7 is that it is transactional, or at least the vast majority of HL7 is transactional in the sense that it is triggered based on some action that happens within one of these systems. So if a patient is admitted to the hospital, there's an admission message that is transmitted out. If a patient has a medication ordered for him or her, it has a message that's sent out. So these messages happen in real time as things happen to or around a patient within the system. So this is what allows us to do real-time integration. And this is HL7 is used at every health system around the country. So it's something that building integration on top of can be reused at various health systems. However, one of the challenges of it is that the messages are customized. So here on the left side is a list of different common message types. So you can kind of get a sense of the different types of data that's stored within HL7 version 2, which is what you're typically seeing. And then we have an example of an ORU message, an observation, just to kind of show you some of the syntax of what HL7 looks like. You'll see on line 3 there we have Jones, Jane, Lee, which might be a patient's name. It might be first name, middle name, last name. It might be last name, first name, middle name. But as you can see in the syntax of the message, it's hard to understand what that data really means. And that's one of the challenges with HL7 is that in order to understand this message, we need to see the message specifications. And those specifications change at each health system. So although you might be able to understand this message if we get the definition of what James, Joan, Lee, of who that is, but that the same message at the next health system or with a different EHR is going to look slightly different. So that's kind of a high level on HL7 and how integration works at health systems, some of the challenges around it. If you're going to sell an integrated product to a health system, we have a couple of best practices that we always talk about with our customers as we're helping them sell these integrated solutions. I see a lot of familiar faces on the webinar, so you've probably talked through a lot of these with us. But to reiterate, if you're going to sell an integrated product, you have to be HIPAA compliant. That's oftentimes the health system isn't even going to ask you this in a meeting because they just assume it. They assume you know how to store this information, and when they come around to giving you that security and connectivity checklist, you're going to have to make sure that your data is stored in a HIPAA compliant fashion. And that's why partners like Aptible are really great for that. The second thing when you're selling an integrated solution is that you have to have your integrated strategy down before you go into that sales meeting. So you have to have that strategy in your back pocket. When you go into your sales meetings to propose your integration solution, you have to say, this is how we integrate, steps 1, 2, 3, 4, 5. This is who needs to be involved and how much time it's going to take. Getting that integrated strategy in place is another thing that will help you do as you're going to market. The other thing that we encourage is what we call a land and expand strategy. And what that means is it's very easy to think of all the different great features that you can offer using all the different types of data that are available within an EHR. However, going with all the bells and whistles, like in your first pitch and in your first implementation with that health system, maybe an easy way to kind of kill your project, because the more data that you're looking to grab from the EHR, the more resources it'll use from IT, and the more it'll increase the exposure of that health data for that application. So we want to limit the scope at first. Oftentimes we'll just use one data feed for the initial project, and then we'll expand after that. Once your product's in place, once it's integrated in a limited fashion, it's much easier to tack on additional pieces to that, and expand your offering and expand your functionality to streamline your workflow and have a bigger impact within that health system. Additionally, when you're selling your product, and as you know, anytime you're selling a product within a health system, you're going to need your champions, right? You need your champion who is going to be using your software, which will often be different than a champion who is buying your software. And you need to kind of convince all of these different parties within a health system to agree. An integration project typically requires a clinical champion, in a sense that you're typically integrating to streamline a provider's workflow or impact patient care, and that all has to do with the clinical body. So you need that clinical champion to stay behind you. After you leave that sales meeting, they're going to be the ones that sticks around and fights for you to get that project approved. And then the last bullet point, might seem obvious to some people, but oftentimes modern application developers aren't thinking about training users because you're building software that's awesome and intuitive enough for users to just understand. But if you think about where your health system users are often coming from, they're in a world where they're using an EHR that has a whole lot of functionality that they've spent months and months training on. And if you don't actually sit in front of your user and tell them, this is when you pull up our application and this is when you turn it on and this is how it interacts in your workflow, it'll make it so they won't use your software as much, and they're not going to kind of intuitively find it because of how dependent they are on the EHR. So training is a big aspect that we definitely encourage as you're in your implementation process. So wanted to really quick show kind of what Redox does to help out with integration. What we do is we host in the cloud as well. We actually host with Aptible to take care of our HIPAA. We're one of those that are riding the lightning and diving in full deep with HIPAA. So we're hosted in the cloud, and we make the data available to you over web services. So you can connect to us over HTTPS, and we transmit data over JSON. So that nasty HL7 data model is something that we hope our customers never have to see and never have to worry about. We give you a set of dev tools and an integration strategy, so you can go into the health system, with that strategy in your pocket, and really depend on us as experts to do all the mapping of that HL7 that's coming out of the health system to this consistent JSON data model. And then when you're ready to implement, we'll actually go in and set up the VPN connection and maintain those connections for you. And the idea being is that you guys can focus on building great applications, focus on delighting your users and building functionality that they need, and we'll focus on maintaining that VPN connection, on configuring the HL7 and taking care of any upgrades that the EHR might go through that might otherwise break a connection. We'll be there to kind of be up in the middle of the night to fix that if it goes down. Some of the data that we make available on Redox I have listed here. Some of these are bidirectional, some of them are read-only, some of them are write-only. Some of them are available via query, like a more REST-style API. So there's a bunch of different things on here that can power your workflow. But if integration is something that you're interested in doing or working on, definitely create an account on Redox. You can pop in there and start getting into what these data models actually have in them, the data dictionaries, as well as examples of what they look like. And then if you want to start talking about your strategy, we'd love to hop on a call and talk through what that actually looks like. So that's it for us. We're going to hop into some Q&A now. So we'll put me and Chaz on the screen and be happy to answer any questions that you guys posted below. So let's do that. Howdy, I didn't realize how close I was. Let's grab Chaz here.
Yeah, we have a gigantic Nico face.
Hello. Sorry.
Okay, so let's start with the first question. How do you deal with lack of understanding of what HIPAA expects? So a lot of times you'll have you'll go in, you try to sell to a hospital or a health system or an insurance company or a pharma company, and you'll hear the most insane, just drivel back. You'll hear stuff like, HIPAA requires that you rotate your passwords every 90 days or something, just unbelievable stuff like that. Has nothing, it's nowhere in HIPAA, has nothing to do with that. So lack of understanding about the technical requirements and what they mean from HIPAA from people who don't understand the technology. Well, what do you do? What's the best thing you can do? Number one best thing you can do is go into those meetings knowing I try not to swear, knowing your stuff cold, right? You want to have you want to know HIPAA way better than them, and then you want to be nice about it and educational about it. Sometimes that involves having documentation prepared. You might have a breakdown of the security rule requirements or the way that you handle HIPAA are ready to go for them. You might have a questionnaire, an inventory like the Cloud Security Alliance CAKE questionnaire, the Cloud Assessment Initiatives questionnaire, that breaks down your security practices and sort of risk management practices for them. And that would, again, show them that you instill confidence that you know what they're talking about, so that when you do tell them that whatever insane requirement that they just invented is bullshit, that they believe you and they're not thinking that you're just being recalcitrant or difficult to work with. So that's the next best thing. Dan, if you have specific, if anybody wants to email me or put specific questions or incidents in the bar here, I'll loop back to that in a sec. Nico, do you want to talk about fire? Clay's comment? Yeah.
Yeah, thanks for asking, Clay. We are hearing fire more and more mostly from software vendors, actually. You don't see fire really in use out in the wild. There's a few health systems that have implemented fire, but they've really done it in a way where their own IT departments have stood up a fire server and mapped over various data feeds from it, either from HL7 or from like reporting databases. As far as widespread adoption of fire goes, I still think we're a few years out from that actually happening. A few barriers are still yet to be overcome. The first thing is fire as a standard needs to be more developed. It's still in its early stages of development, and there's still a lot of concerns with how it actually structures some of the data, some problems in the data model that we found. And until that happens, we're not going to see the EHR vendors start implementing it. And when we do, we've talked to various EHR vendors about fire and where they're at with implementation of it. So they're waiting on the standard to be more mature. Additionally, it looks like their first implementations of fire will be read-only. So we might start being able to see some of that information come out in a read-only fashion. But what it's going to take is the EHR vendor to implement it. Then it's going to take the health systems to upgrade their EHRs to support that, which will take another couple of years from now for that to happen for some of the bigger EHR vendors. What we're seeing happen faster than that, though, is sort of people like Redox and other middle layers that are able to take the existing standards that are used, HL7, within the health systems and make those available over web services as well. As health systems start adopting fire more prevalently, we'll be able to support the fire as well as HL7. So it's something that we're all keeping an eye on. Our developers are actively commenting and helping out with the development of fire, and it's something that we're excited to see in the next couple of years. So thanks for the question, Clay.
Jeff, do you have some tips for making it through a corporate review board, enterprise review board? Same thing with security questionnaires from institutional review boards, if you're in research, security and HIPAA quickly as flawlessly. That question is very similar to, the answer to that question is very similar to the previous question, which is just have your documentation and sort of as much compelling evidence that you know what you're talking about together beforehand, and then usually you're going to preempt a lot of other questions. We can talk. We should do a blog post or something where I could give you more detail about this in a more open-ended forum. I will. The last question I have is from Stephen, which is an Aptible specific question about our products and services. And the other question here is from Michael about Redox. So Nico, why don't you answer Michael's question about products, and then I'll answer the product question from Stephen.
Sure. Yeah, Michael, the question was, does Redox support real-time patient search against the connected EHR? And so, yes, that is a data model that we have available. So in order to do a patient search, we actually require a set of patient demographics. So it's often the name, date of birth, phone number, social sometimes. And the reason why it sometimes is the amount of demographics that you need to match on to match with a patient within an EHR varies based on that implementation. So it's something that each health system configures within within their implementation. So sometimes you might just need name, date of birth, phone number, zip code. Sometimes you also need the social. So it's something that as you're doing your implementation at a health system, it's one of the discovery questions that we go in with when we're doing a patient search implementation. So thanks for the question. And if you're looking for the syntax on how that query actually works, register for Redox, and you can find it in our documentation.
Okay. So I'm going to answer Steve's question about basically what's the difference between Aptible and AWS. AWS offers, Aptible is built on top of AWS. AWS offers a variety of what they call HIPAA eligible products, which are products that with certain configurations can be used under their business associate agreement. We use those products to build Aptible and offer it. You can use those products on your own. You can use EC2, ELB, EBS, which are the core products that Aptible exposes as a platform. You can use Redshift, Glacier, S3 directly from Amazon. All good stuff there. So Amazon publishes a white paper on architecting for HIPAA compliance, which is good. What they don't do is they don't tell you that if you do any of this stuff that you'll actually be compliant or in the right direction. They basically say, look, here are the permissible rules for using AWS architecture. Good luck with the rest of it. Figure it out on your own. Here are some suggestions. That's a bit different from what Aptible does, which is we put together a product, we update it, run it, manage it, insure it, indemnify you against breaches resulting from our basically anything that's in our lane or is our responsibility. We indemnify you against any security incident that results in a breach. And we also offer a compliance platform and some help with the administrative aspects with HIPAA too, which are only available if you're on the deployment platform right now. So the deployment platform saves time and sort of risk standing up your own HIPAA compliant architecture. And then it allows you to use the compliance services and the compliance tools to finish the rest of the work you have to do under HIPAA. That's an extremely abbreviated version, but basically save time standing up an architecture, save time running it. We monitor your stack for a lot of common ops issues, so you're able to get by with fewer ops engineers. And then we basically accept the risk from managing and running security for that stack. Which again is something that AWS doesn't do. I hope that's somewhat helpful. We should probably have I think we may have some collateral around this. If anybody else is interested, you can email sales@aptible.com or Shah, who's our sales guy, Shah, SHAH @aptible.com, and we can give you a more detailed breakdown of what the differences are and what the walkthrough is. I think we have a one-pager on Aptible versus AWS, and then there's another one-pager on just how to get set up with Aptible, what happens next, stuff like that. So
yeah, and okay. One thing that we can do, I'll answer this last question here, but one of the things that we'll do after the webinar is I think we got all of your email addresses from your registering, so we'll send out a follow-up email that has contact information for both resources at Aptible and at Redox, and also some links to some of the resources that we talked about, including the deck that we went over today. So the last question that's on here, and feel free to ask any others while I'm talking about this one, but do we mention Redox in meetings with providers to let them know we're syncing with their system? How do we know if Redox supports that provider? It's a great question. I'll answer the second one first. We've designed our system to really work with any meaningful use certified EHR. So any EHR that's in use right now that providers are using, we should be able to do integration with. So that's kind of a high level, we are confident in our ability to work with any EHR. We have run into situations where the EHR vendor themselves have licensed some of the interfaces that are needed to do the integration. So sometimes they have to actually ask for more money from the provider group to turn on some of the interfaces. So we can talk through that with you as you're preparing to do your integration. And that's part of that integration strategy part of it, part of our project. So when we start working with our customers, we talk about, what data do you need? What EHR systems are you looking at, and what health systems are you looking at selling to? And we can kind of give you the lowdown on the infrastructure and what sort of roadblocks will come up during that process. And then as far as mentioning Redox is to do the integration portion of it, typically our customers are saying, we're using Redox as a partner to do integration. Health systems are used to software vendors using integration partners because it's such a specific skill set that they actually like it when they have partners come in. Typically, it's consultants that are doing it, and we're not consultants. We have this API software platform, but the health system thinks that we're consultants. They look at us and they're like, oh, that's the integration dude, and we're happy that the health system thinks that, and that's fine. But we'll get you plugged in, and we'll get it up in a way where you can start interacting with that API, and then we'll maintain it after that. And then it looks like the last question here, how much time does it take to get set up working with an EHR that we may not have worked with before? Great question. The implementation process for new EHRs and new health systems are typically around 4 to 6 weeks. What we'll do, as we're doing that discovery with you is we'll identify, what the EHR is, what are the data models, and we'll put together this timeline for you. And it comes in the form of a document that you can actually, take the content out of, put your own logo and name on it, and we can bring that to the health system together and say, this is what the integration project plan looks like. And, depending on the scope of the project, it might be, 5, 6 weeks, and it'll also include all of the different people who need to be involved from the IT team and, what the different phases of the project are. Typically, it starts out with, we connect to that health system. We ask for sample data from that EHR. So they send us some sample HL7 messages. We spend a couple days mapping those HL7 messages into our JSON data models, and then we send that all the way through to you so you can start your testing process. We go through full testing across all the different use cases, and then we move it to production, and then we watch data flow in production, and then you're basically live after that once your users want to start using it. So that process, again, 4 to 6 weeks, depending on the scope of it. The variation in that is typically happens because a health system will want to schedule a meeting, 2 or 3 weeks out, or different things like that. So there is some variability in it based on the engagement from the health system. Okay, cool. I think that about covers it. There's no more questions down here. So I'd like to thank our friends at Aptible for co-hosting this with us, and we'll be sending out a bunch of contact info, resources. You'll get a nice, hopefully succinct email with a lot of this content in it here later today. And definitely reach out to either one of us if you have further questions or want to continue the discussion. And thanks for joining.
All right, thanks everybody.